We are meeting at a time where financing the WHO's global health agenda has demanded our full attention and has hastened the need for us to be creative in developing innovative means of financing, from broadening the donor base and reducing our dependence on a limited number of traditional donors, to challenging the Secretariat to raise more resources through new avenues. We must mobilize financing in a fiscally conservative global environment. Importantly, we need to agree to the next increase of assessed contributions for 2026-2027 by 20%. Without this increase, the objective of raising assessed contributions to cover 50% of WHO's base budget by 2030 will not be guaranteed. We all recognize the need for reform and must acknowledge the progress made thus far by the WHO Secretariat and the discussions under the guidance of the member state leads on governance reform. Colleagues, a compromised or fragmented global health system not only costs lives, but also poses one of the greatest threats to the global economy and global security. The issues before us and the decisions that we make this week will be consequential to the future of WHO as an institution, to global health governance, and to the health of billions of people across the world. We must therefore focus on concrete deliverables that redound to what we envision the WHO to be in the future: an organization that is fit for purpose, sustainably financed, and agile enough to address its program work and any health emergencies that may arise. I was delighted to exchange views with many of you during yesterday's informal meeting of the board. We discussed critical issues confronting the WHO and agreed that whilst the matters before us may not be simple, they are of utmost importance to the future of the WHO. I therefore trust our collective resolve to support WHO's functions and to develop viable solutions for sustainable financing. I will now present a summary of the informal meeting. I would like to take this opportunity to report to you on yesterday's informal meeting of the Executive Board, which I just mentioned. We met for a full day in a relaxed format, and at the outset, we considered the outcomes of the PBAC last week and express our appreciation to the PBAC Chair, Dr. Catherine Loftus, for her excellent stewardship. We also acknowledge that WHO is in a challenging phase after the announcement by the United States of its intention to withdraw from the organization, and recognize the important role of the board in guiding the Secretariat during this time. To this end, we rolled up our sleeves and delved into two main topics. First, we turned to the matter of governance reform and considered the member state-led governance reform process and the proposal that member states discuss in the coming months a more sustainable model for governance reform. We expressed our deep appreciation for the work of the member state leads on governance reform and agreed it would be important to maintain the momentum on this important issue. We also reflected on agenda management and resolution management, paying particular attention to the financial implications of draft resolutions, including those that the board is expected to consider at its 156th session. Furthermore, we highlighted the challenge of participating meaningfully in the recent negotiations of some 20 or so draft resolutions and discussed whether there might be mechanisms for addressing such a large volume. For example, we discussed how in instances where the objective of a resolution is to raise awareness and for advocacy rather than to create new work streams, other instruments such as side events might be more prudent. While noting that proposing resolutions to the governing bodies is the prerogative of member states, we recognize that future proposals for resolutions could be informed by gap and risk analyses, clear identification of costs, and possible funding sources, priorities as expressed at the country level, and an analysis of linkages to the 14th General Program of Work. It was also pointed out that the officers of the board might have a role to play in gathering information and having informal discussions about proposals. We discussed how the board might consider requesting the Secretariat to prepare for this week an information document providing an overview of the cost implications and options for addressing the potential challenge of additional activities for WHO in view of the current concerns about financing. In addition, we may wish to request that the Secretariat prepare a paper for our May meeting identifying reforms that have been implemented and others that are needed to help us move forward. Next, we turn to the strategic matters. We discussed the development of the proposed program budget 2026-2027 and the three options which were presented in light of the expected decrease in financing. We noted the PBAC's proposal to decrease the base segment of the program budget for 2026 to 2027 to US $4.9 million, which we will be discussing later today. We also recognize the PBAC's support for the 20% increase in assessed contributions and how such an increase constitutes a logical step in the sustainable financing journey. This would follow on from WHO's first investment round, which was launched last year. Several possible approaches to innovative financing were discussed, including a WHO endowment fund. There was a common understanding that WHO is in a difficult situation and that our consideration of the budget and on WHO reform could not be business as usual. In response, WHO would pursue the twin goals of resource mobilization and efficiency gains. In our discussions, we highlighted the need for WHO to improve its communications activities, including in country offices. We also noted that other avenues would also be explored in order to broaden the donor base and improve the quality and sustainability of funding. All in all, we had a very positive day of exchange and getting to know each other better. I would like to thank the members of the board for coming out on a Sunday afternoon ahead of a week and a half of intense discussions, as well as for their frank and active engagement that will surely contribute positively to the work before us. It is my pleasure to welcome all executive board members and their alternates and advisors. I would also like to cordially greet representatives of member states, observers, United Nations, various United Nations bodies and specialized agencies, other intergovernmental organizations, and non-state actors in official relations with WHO, whose participation is further evidence of the close relations between WHO and these organizations. Finally, welcome to our Secretariat colleagues who are following and supporting the deliberations of this meeting. Let us now turn to the consideration of the agenda for this session of the board. In accordance with the provisions of the rules of procedure, the board has before it this session's provisional agenda contained in documents EB 156/1 and EB 156/1 annotated. In accordance with Rule 8 of the Rules of Procedure, the Executive Board, the officers of the board with the Director General met with the Director General on 8th of October 2024 to review the draft provisional agenda of the 156th session of the board that had been circulated to member states on July the 2nd, 2024. Proposals received from member states by the deadline of the 24th of September 2024 were considered, and the provisional agenda was agreed by the officers of the board. At this time, I would like to propose the deletion of the following agenda items, as I understand they are not needed. Sub-item 23.3, Scale of Assessment 2026 to 2027. Sub-item 23.4, Amendments to the Financial Regulations and Financial Rules. Sub-item 26.2, Independent Expert Oversight Advisory Committee Membership Renewal. These items are included systematically on the agenda in case they are needed. In this instance, they are not needed. May I take it that the proposals are acceptable? I see no objection. It is so decided. Are there any further comments on the provisional agenda? I see none. Thank you. The agenda is therefore adopted.
All of these cells can
I give the floor to Pope Poland. I can see it.
Thank you, Mr. Chair, Director General, members of the Executive Board, dear colleagues. The European Union works closely with the World Health Organization on a wide range of subjects, both within the European region and on a global level. As agreed in the exchange of letters of the year 2000 between the WHO and the European Commission concerning the consolidation and intensification of cooperation, and without prejudice to any future conclusion of a general agreement between the WHO and the European Union, the European Union delegation attends the meetings of the Executive Board as observer. As in previous EB meetings, we ask the Executive Board to kindly agree that the European Union delegation is also invited to attend and participate without vote in the deliberations of the meetings of its committees and subcommittees, drafting groups or other subdivisions thereof, addressing matters falling within Union competence in the 156th session of the Executive Board. I thank you.
Thank you very much. I understand that this is a usual practice in the Executive Board. Dear colleagues, do you agree to proceed in this way? I see no objections. Thank you. As you know, the EB 156 has a heavy agenda with 47 items and sub-items and approximately 38 draft resolutions and decisions to be considered. All participants are encouraged to be concise when taking the floor. I would like to request that statements focus on the guiding questions provided in the reports prepared by the Secretariat. We will also have these guiding questions projected on the screen during our discussions. With that in mind, EB members are encouraged to limit their interventions to 3 minutes. Individual statements by all member states not represented on the board and associate members will be limited to 2 minutes. Statements by observers, invited representatives of United Nations agencies and other participating intergovernmental organizations and non-state actors in official relations with WHO will be limited to 1 minute. Regional and group statements will be limited to 4 minutes. I would like also to inform you that as agreed, constituency statements by non-state actors in official relations will continue during this meeting and will be provided on the following selected agenda items. Item 6, universal health coverage. Item 12, health and care workforce. Item 15, WHO's work in health emergencies. Item 18, universal health and preparedness review. Item 22, climate change and health. Item 24.2, governance reform, involvement of non-state actors in WHO's governing bodies. Constituency statements delivered on behalf of a group of several NSAs will be limited to 3 minutes and will be delivered after all EB members, intermingled throughout the discussion and among statements by member states not represented on the board. In order to help speakers observe the time limits, I have asked the Secretariat to keep in place some of the innovations introduced by the PBAC chair last week, namely to provide a chime when the traffic lights change from green to yellow, and again when it changes from yellow to red. Though I don't anticipate the need to cut anyone's microphone, there is a possibility of doing so with any statements that run well beyond the time limits. When we move to the agenda items considered last week by PBAC, I propose to build on the good work of that committee by focusing our discussion on the PBAC report and its recommendations, rather than having another full discussion of each of the documents. May I take it that these proposals are acceptable? I see no objection. It is so decided. Let us now review the preliminary daily timetable contained in document EB 156/2. It is proposed that the board meet this morning until 12:30 and then this afternoon from 14:30 hours to 17:30 hours. On each of the remaining days, I propose that we meet from 10 to 1 and from 2:30 to 5:30. This morning, following the conclusion of item 1, the board will consider item 2, report by the Director General, which will be followed by item 3, report of the regional committees to the Executive Board, and item 4, report of the Program Budget and Administration Committee of the Executive Board. The board will then turn to item 24, management and governance matters, and take up sub-item 24.2, governance reform, which includes 5 bullet points. I propose that we discuss the first 3 bullet points together and then have a separate discussion on the last 2 bullets. Following the discussion on governance reform, I propose that we take up sub-item 23.1, financing and implementation of the program budget 2024 to 2025, followed by sub-item 23.2, proposed program budget 2026 to 2027. Tomorrow, Tuesday, the 4th of February, at 10 a.m., I propose that the board take up Pillar 1 items. In the afternoon, we will return to item 27, staffing matters, and consider items 27.1 and 27.2 in a private meeting concerning the appointment of the Regional Director for Africa and Europe regions, respectively. I would like to remind you that the private meeting is held in compliance with Rule 7 of the Rules of Procedure of the Executive Board, which means that members of the board, their alternates, and advisors can attend, and that member states not represented on the board and associate members can send 1 representative each without the right to participate, and that the Secretariat's attendance will be limited to essential staff only, and that no official record shall be made. Do I take it that the board agrees with these proposals? As I see no objection, it is so decided. When delivering statements, I would like to remind delegates to speak at a moderate speed that allows for its interpretation and ensures their message is conveyed clearly and accurately. Please send a copy of your written statements in advance to the email address interpret@who.int at least 30 minutes in advance of delivery. This does not prevent you from making changes on delivery, but will facilitate clarity and accuracy in all languages. If you would like your statement to be posted on the WHO website, or if you have a longer statement with supplementary information you would like to share, you may send it to the email address statements@who.int. Please be reminded that written statements will not be included in the summary record of the meeting. Are there any comments before we proceed? I see none. Thank you. I see none. Thank you. Finally, I would like to remind board members that in accordance with Rule 32 of the EB Rules of Procedure, proposals for resolutions or decisions to be considered by the board relating to items of the agenda should be introduced at least 15 days before the opening of the session, and may in any event be introduced not later than the close of the first day of the session, and these should be sent to governance unit at who.int by 6 p.m. today. Before moving to the next item, I understand that we will receive comments from the Office of the United Nations Secretary General, delivered by Deputy Secretary General Amina Mohammed. Thank you.
Excellencies, ladies and gentlemen, my dear brother Tedros, as we gather at a defining moment for global health and the world faces escalating threats on many fronts, geopolitical tensions, deepening inequalities, climate shocks, and the erosion of multilateralism. In these trying times, the entire United Nations stands in support of the World Health Organization and its mandate to promote, provide, and protect health in every country around the globe. Global health needs are expanding. Conflicts, disease outbreaks, and demographic shifts, which are stretching diminished resources to their limit. Whether responding to deadly disease outbreaks like Ebola, Marburg, cholera, or measles, in violent conflict or disasters mobilizing in humanitarian crises, or in the face of COVID and other pandemics, WHO is there, deploying life-saving resources, coordinating international response, and providing its unparalleled technical expertise where it is needed most. Excellencies, WHO's role extends far beyond crises and emergencies. As the world's leading public health authority, it is the guardian of global health, setting standards, coordinating international responses, and ensuring that people everywhere, no matter where they live, have access to the care that they need. Yet we know that there is still much more to do. The outcomes of the 2023 General Assembly high-level meetings on universal health coverage, antimicrobial resistance, and pandemic preparedness have strengthened our collective resolve. And in September, member states came together and agreed on the Pact for the Future, reaffirming that investing in health is investing in people, economies, and the planet. Now, the real test is implementation. This is where the UN development system, including our resident coordinators and our UN country teams, play a critical role, turning global commitments into action on the ground, in communities, and in the lives of those who need it most. With the 2030 deadline for Sustainable Development Goals fast approaching, our resolve must be stronger than ever. This is the decade of action, and the countdown is on. Health is the foundation of sustainable development. Without strong health systems, we cannot end poverty, advance gender equality, or protect our planet. There is no option B. Investing in health and in a resilient WHO is an investment in a prosperous, healthy, and a safer world for today and generations to come. I wish you fruitful deliberations. Thank you.
Thank you. This concludes our consideration of agenda item 1. Let us now consider item 2 of our agenda, report by the Director General contained in document EB 156/2. It is now my pleasure to give the floor to the Director General, Dr. Tedros Ghebreyesus. Dr. Tedros, you have the floor.
Thank you, Chair. Honorable Chair, Dr. Jerome Wolcott, honorable ministers, dear colleagues and friends. Good morning, Happy New Year, and welcome once again to your WHO headquarters. As you know, for me, 2024 ended with a narrow escape in Yemen when the airport in Sana'a was attacked while I was there, waiting for my flight home. I think starting your year with that is not funny. And I want to express my heartfelt gratitude to each of you who reached out with calls and messages of support. Your kindness provided comfort during such a frightening moment. My email, my WhatsApp, all actually, my accounts were flooded. So that just wanted to express my gratitude to you, and also I thank God for sparing me. I was fortunate, but it was a reminder of the threat that so many people live with every day in dangerous situations around the world, including many of my WHO colleagues, the UN colleagues, and humanitarian at large. For them and for WHO as a whole, 2024 was a year of significant challenges. It was also a year of significant milestones. At the World Health Assembly in May, member states approved our new global health strategy, the 14th General Program of Work, with an ambitious target to save 40 million lives over the next 40 years, over the next 4 years. You also approved a historic package of amendments to the international health regulations, and you agreed to conclude negotiations on the WHO pandemic agreement in time for next World Health Assembly. In November, we also concluded the first WHO investment round, which helped to mobilize half of the resources we need to implement GPW14 over the next 4 years. And in December, I joined President Macron to officially open the WHO Academy in Lyon, a major step towards making WHO an organization that delivers an impact in countries. There were also many achievements to celebrate in our threefold mission: promote, provide, and protect health. First, our mission to promote health and prevent disease by addressing its root causes. As you know, non-communicable diseases account for 7 of the top 10 causes of death globally, including cardiovascular disease, diabetes, cancer, and chronic respiratory disease. One of WHO's key focuses is addressing the risk factors for NCDs in the food people eat, the air they breathe, the roads they use, and the products they consume, including tobacco, the world's leading cause of preventable death. This month marks the 20th anniversary of the entering into force of the WHO Framework Convention on Tobacco Control. Over the past 2 decades, thanks to the WHO FCTC and the Empower technical package that supports it, smoking prevalence has dropped by 1/3 globally. Last year, Georgia, Lao PDR, and Oman introduced plain packaging on tobacco products. With WHO support, Vietnam prohibited e-cigarettes and heated tobacco products. And through the partnership in the Tobacco-Free Farms Initiative, we have supported more than 9,000 tobacco farmers in Kenya and Zambia to shift away from growing tobacco to growing high-iron beans. Another key focus is addressing the drivers of disease in the diets people eat. In 2024, Lebanon, Mauritius, and Nepal passed best practice policies on trans fat elimination. 34 countries have now joined the acceleration plan to stop obesity, representing 1/3 of the global population with obesity. We published a new guideline on wasting and supported 14 countries with the highest burden to implement it. We're also seeing progress in preventing deaths and injuries from drowning, road traffic crashes, and violence. We're integrating behavioral science into more areas of our work. And we continue to support countries to build climate-friendly and climate-resilient health systems. We have mobilized $150 million to support low and middle-income countries to protect the health of their people from climate risks. And at COP29 in Azerbaijan, we signed an agreement to keep health at the heart of climate negotiations. Second, our mission to provide health by expanding equitable access to health services. As you know, more than half the world's population lacks access to one or more essential health services. And 2 billion people face financial hardship by paying for care out of their own pockets. To address these gaps, we're working through the UAC partnership to support 125 countries in all 6 regions on the road towards universal health coverage. Last year, we provided support to 28 countries to develop packages of services for universal health coverage, including 8 countries with humanitarian crisis. And we are supporting countries to expand health services to refugees and migrants. Ireland and Panama integrated refugee and migrant health into national healthcare plans. Uganda provided a comprehensive health package to 1.6 million refugees. And Colombia issued health insurance cards to 1.5 million migrants. Just as we work to expand access to health services, so we are working to expand access to medicines and health products and to strengthen regulatory authorities around the world. We recognized Egypt, India, Rwanda, Senegal, and Zimbabwe for achieving or maintaining maturity level 3 for regulatory oversight of medicines and vaccines. As WHO-listed authorities, making them regulators of reference that meet internationally recognized standards and practices. We have now listed 36 regulators since we launched the program 3 years ago. In 2024, we pre-qualified 87 medicines and other products and performed more than 150 inspections of manufacturing sites. We launched a new platform with information on 2,000 types of medical devices, which countries are using to select devices for health interventions, procurement, or national reference lists. We issued 5 alerts on substandard and falsified medicines. And we selected 481 non-proprietary names for active pharmaceutical ingredients. The International Non-Proprietary Name Program is one of those things that WHO does that no one else can do, and that very few people know about, but is relevant to all countries. Standardized names for pharmaceutical ingredients are absolutely essential for patient safety, global trade, tracking and tracing medicines, combating counterfeits, increasing access, research, and more. It's not glamorous, but someone has to do it, and that someone is WHO. And it's helping to increase access to life-saving tools, including vaccines. On antimicrobial resistance, the UN high-level meeting on AMR resulted in strong commitments and targets. The number of countries reporting data on antimicrobial resistance, on antimicrobial use to WHO has tripled from 36 in 2021 to 98 in 2024. And countries are adapting our aware recommendations on antibiotics. Nepal, for example, has banned the use of antibiotic combinations that WHO classifies as not recommended. We also supported full implementation of surveillance for antimicrobial resistance, gonorrhea, in 13 countries. In Cambodia, implementing WHO guidelines reduced gonorrhea treatment failure from 11% to 0. We also developed the first guidance on wastewater and solid waste management for manufacturing of antibiotics. Already we have trained inspectors in 52 member states, and the AMR Industry Alliance updated its standard to align with WHO guidance. Last year, we celebrated the 50th anniversary of the expanded program on immunization. When EPI was launched in 1974, less than 5% of the world's children were immunized. Today, that figure stands at 83%. I would like to pose and ask you one question here. Do you know the Director General who started the EPI program? No? It's Mahler. So I just wanted to underline that. EPI has been the single biggest contributor to infant and child survival globally, preventing 154 million deaths, an average of 8,000 a day for 50 years. And we continue to support countries to introduce new vaccines to save lives. In 2024, 4 new countries introduced HPV vaccines. Niger and Nigeria became the first countries to implement the new MEN5CV vaccine, meningitis vaccine. We pre-qualified a new vaccine against dengue, and we supported the rollout of more than 12 million doses of malaria vaccine in 17 countries in Africa. Meanwhile, we're living in a golden age of disease elimination, with more and more countries liberating their people from malaria, trachoma, leprosy, lymphatic filariasis, and more. Last year, we certified 7 countries for the elimination of neglected tropical diseases: Brazil, Chad, India, Jordan, Pakistan, Timor-Leste, and Vietnam. And just last week, we certified Guinea for the elimination of human African trypanosomiasis, and Niger for the elimination of onchocerciasis. Last year, only 11 human cases of guinea worm disease were reported from just 8 villages in Chad and South Sudan. Ghana approved a new treatment for river blindness, which was developed through 2 decades of collaboration between TDR, researchers, WHO country offices, and medicines development for global health. We also certified Capo Verde and Egypt as malaria-free, and already this year, Georgia has reached the same status. Belize, Jamaica, and St. Vincent and the Grenadines were validated for the elimination of mother-to-child transmission of HIV and syphilis. And we validated Namibia for being on the path to elimination of mother-to-child transmission of HIV and hepatitis B. For the first time, TB treatment coverage has now reached 75% globally. 79 countries have achieved at least a 20% reduction in incidence, and 43 countries have achieved at least a 35% reduction in TB deaths. And on mental health, we're working with UNICEF in 13 countries in all 6 regions, reaching 270,000 children, adolescents, and caregivers with care services. On maternal and child mortality, progress is less encouraging. After substantial improvements during the MDG era, progress has stalled. We continue to work with member states to identify the barriers and to give them the tools to overcome them. For example, to increase uptake of family planning practices, we developed a protocol to rapidly assess bottlenecks, which 27 countries are now implementing. We published a new guideline on neonatal sepsis, and we're supporting countries to implement it. And we launched guidance on midwifery models of care, which has been shown to reduce emergency cesarean section, preterm birth rates, and admissions to neonatal intensive care. Over 90 countries have developed acceleration plans to reduce maternal and newborn mortality and prevent stillbirths. Tanzania opened 30 new care units for newborns, while Pakistan, Ghana, Sierra Leone, and Malawi are also making progress. We have come a long way on maternal and child mortality, but we still have a long way to go to reach the SDG targets. For World Health Day this year, we have chosen maternal health as our theme to draw attention to the need for all countries and partners to work together and prevent these preventable diseases. Now to the third pillar of our mission, supporting countries to protect health by preventing and responding rapidly to health emergencies. In 2024, we responded to 50 graded emergencies around the world: conflicts, outbreaks, natural disasters, and more. This included delivering $48 million worth of supplies to 78 countries. We helped bring cholera outbreaks under control in 27 of 33 affected countries, leaving only 6 in an acute phase. With WHO support, Rwanda controlled an outbreak of Marburg virus disease. And as we speak, we're responding to outbreaks of Marburg in Tanzania and Ebola in Uganda, where Deputy Director General, Dr. Mike Ryan, has traveled to oversee the response. And as you know, in August last year, I declared a public health emergency of international concern over the outbreaks of Mpox in the DRC and other countries in Africa. Although the number of reported cases has been stabilizing in DRC, the worsening security situation has led to many patients leaving treatment centers, increasing the risks of high transmission. In response to the outbreak, WHO gave emergency use listing to the first Mpox vaccines and tests and established an access and allocation mechanism which coordinated donations of 6 million vaccine doses across 15 countries. About 500,000 doses have been delivered, and a further 1.7 million doses will soon be available. We also provided supplies to laboratories in 136 countries to quality assure their capacity for diagnosing Mpox. About 70,000 people have been vaccinated, mainly in DRC, and resource limitations in the affected countries which face multiple competing health priorities have limited the speed and scale of vaccination. The other main part of WHO's emergency response work last year was responding to conflicts and insecurity in Gaza, Haiti, Lebanon, Sudan, Ukraine, and elsewhere. We're very pleased to see that the ceasefire agreement in Gaza is holding, and we very much hope it becomes a lasting peace. Our priorities are to meet acute health needs, support the operation of hospitals and primary care facilities, and transport patients within and out of Gaza for specialized care. Since the ceasefire began, WHO has sent 63 trucks with supplies, and 30 more should arrive in the coming days. We provide 60% of all the medical supplies and 100% of the fuel for hospitals and emergency medical facilities. In total, during the conflict, we coordinated the deployment of 52 emergency medical teams from 26 organizations, which conducted over 2.4 million medical consultations, performed more than 36,000 emergency surgeries, and treated almost 86,000 trauma cases. And together with our partners, we negotiated a humanitarian pause and prevented a resurgence of polio by vaccinating more than 550,000 children. We can only hope that 2025 also brings an end to the conflicts in Sudan and Ukraine. In Sudan, an estimated 32,000 people have been killed, 30% of the population is displaced, and 20 million people need humanitarian aid. I visited Sudan in September, where I saw the effects of civil war and met people who are paying the price. The following week, I was in Chad, where I traveled to the border town of Adre and met some of the 900,000 Sudanese refugees who fled, seeking security and food. And they're just a fraction of the 122 million people globally who have been forced to flee their homes. In Gaza, Lebanon, Sudan, Ukraine, and elsewhere, we continue to see attacks on healthcare, which are becoming a new normal of conflict. Last year, we verified more than 1,500 attacks on healthcare in 15 countries and territories, with 932 deaths and 1,767 injuries. It's frustrating that almost no one is ever held to account for these violations of international law. So with our partners, we launched a new report last year with 9 recommendations for bringing to account those who perpetrate attacks on healthcare. We urge member states to implement these recommendations. Of course, responding to emergencies is just one part of our work. In response to the lessons learned from COVID-19, WHO has strengthened its work in every dimension of emergency prevention, preparedness, and response. Every day, we scan the world for public health threats. Last year, we assessed more than 1.2 million potential signals. And through the WHO Hub for Pandemic and Epidemic Intelligence in Berlin, we're supporting countries to strengthen their capacities in genomic surveillance. The International Pathogen Surveillance Network, established in 2023, now includes 230 organizations in 85 countries. We supported 19 countries to complete joint external evaluation, with another 21 scheduled for this year. And 3 countries completed pilot studies of the Universal Health and Preparedness Review. In addition to these general preparedness activities, we are also supporting countries to prepare for specific threats, including Ebola. Ebola outbreaks are often fueled by nosocomial transmission. So with Gavi, we vaccinated 150,000 health workers in 6 countries against Ebola, the first time this has happened outside of an outbreak response to prevent any future outbreak. We also supported the vaccination of 53 million people against yellow fever in 5 countries. And we have monitored carefully the concerning spread of avian influenza among dairy cattle in the United States. Through the Global Influenza Surveillance and Response System, GISRIS, we facilitated sharing of more than 100 zoonotic flu samples with WHO collaborating centers last year, and uploaded 525 influenza genetic sequence to publicly available databases. And we recommended 9 new zoonotic candidate vaccine viruses available globally to manufacturers to produce vaccines in case of an influenza pandemic. Honorable ministers, dear colleagues and friends, all of this work to promote, provide, and protect health is supported by our efforts at all 3 levels of the organization on the 4th and 5th piece of GPW 14 to power and perform for health through science, digital technologies, data, and our ongoing transformation. Last year, we conducted a review of our transformation to see what has worked and what has not. Based on the review, we have reprioritized transformation and aligned it with priorities of GPW 14. One of the successes of transformation has been the establishment of the Science Division. WHO's normative standard setting work is its bread and butter, as you know, and the Science Division is helping us make sure we give member states the highest quality, evidence-based advice as fast as possible. Last year, there were 65 million downloads of WHO publications, guidance, and other materials. We launched important new guidelines on avian influenza, artificial intelligence, tobacco cessation, mpox diagnostics, and so much more. Starting this year, we are aligning our guidelines and normative work with pre-qualification, meaning we will pre-qualify a product and issue guidelines on how to use it at the same time. This will speed up equitable access to proven interventions and increase investments from the public and private sectors as the systems will become more transparent and predictable, completed within a 12-month period. The first product under this new process will be lenacapavir, an exciting new medicine for the treatment and prevention of HIV. Although a true HIV vaccine remains elusive, lenacapavir is the nearest thing we have to it. A new injectable antiretroviral taken every 6 months that has been shown to prevent almost all HIV infections in those at risk. We have initiated the guideline and pre-qualification processes in parallel, which will support the rapid rollout of this product, which we expect in the first half of this year. Another success of transformation has been our increased focus on digital health, which will underpin health systems in every country in the very near future. Last year, the Global Digital Health Certification Network enabled Oman, Indonesia, and Malaysia to issue 250,000 international patient summaries for 2024 Hajj pilgrims, supporting emergency care for 78% of scanned records. The network now covers 82 countries, benefiting nearly 2 billion people. And I thank EU for the support in this. Another key element of our transformation has been our focus on data. We created the World Health Data Hub to make health data available to anyone, anytime, using digital technologies, including artificial intelligence. Every country in the world now accesses the hub, which is a secure and standardized pathway to increased transparency, accountability, and progress. Honorable ministers, dear colleagues and friends, as you know, 2 weeks ago, President Donald Trump signed an executive order announcing his intention to withdraw the United States from WHO. We regret the decision, and we hope the US will reconsider. We would welcome constructive dialogue to preserve and strengthen the historic relationship between WHO and the USA that helped bring significant impacts like the eradication of smallpox, and I can give you a long list. The executive order gave 4 reasons for the decision to withdraw from WHO. First, it says that WHO has failed to adopt urgently needed reforms. As this board is aware, over the course of the past 7 years, under the guidance and governance of member states, WHO has implemented the deepest and most wide-ranging reforms in the organization's history. The WHO transformation has touched every part of our work, our strategy, operating model, processes, partnerships, financing, workforce, and culture. We have also taken action on the recommendations of the Agile Member States Task Group. We have implemented 85 of the 97 reforms proposed in the Secretariat Implementation Plan on Reform, or SIP. And we are implementing the recommendations of the Action for Results Group led by WHO representatives to strengthen our country offices. For us, as we always say, change is a constant. And that's what our member states told us when we started the reform. Change is a constant. We believe in continuous improvement. And we would welcome suggestions from the United States and all member states for how we can serve you and the people of the world better. So although we're doing a lot of reform, but additional is welcome. Second, the order says that WHO demands unfairly onerous payments from the US out of proportion with what other countries contribute. Member states understand how assessed contributions are calculated. And you know, some countries choose to make higher voluntary contributions than others. Addressing the imbalance between assessed and voluntary contributions and reducing WHO's overall reliance on a handful of traditional donors has been one of the major areas of transformation. Because when we started the transformation, reliance on few traditional donors was identified as a risk. And we have decided then, 7 years ago, to broaden the donor base. Last week, the PBAC recommended the next 20% of increase in assessed contributions, and we asked this board to endorse that recommendation. This is a critical element of our long-term plan to broaden our donor base and will, over the long term, reduce the burden of financing from traditional donors, including the US. We therefore continue to seek the support and engagement of all member states, including the US, for our shared vision to put WHO on a more sustainable financial footing. Third, the order refers to WHO's alleged mishandling of the COVID-19 pandemic and other global health crises. Last week marked 5 years since I declared a public health emergency of international concern. On the 30th of January 2020, and at the time, outside of China, there were fewer than 100 reported cases and no reported deaths. On New Year's Eve 2019 and New Year's Day 2020, when much of the world was on holiday, WHO was not. I think you remember that. From the moment we picked up the first signals of viral pneumonia in Wuhan, we asked for more information, activated our emergency incident management system, alerted the world, convened global experts, and published comprehensive guidance for countries on how to protect their populations and health systems, all before the first death from this new disease was reported in China on the 11th of January 2020. Of course, there would be challenges and weaknesses, and there have been multiple independent reviews of the global response to COVID-19 with more than 300 recommendations to address the challenges or the weaknesses. In response to those recommendations, WHO and our member states have taken many steps to strengthen global health security, the Pandemic Fund, the WHO Hub for Pandemic and Epidemic Intelligence, the mRNA Technology Transfer Hub, the Global Training Hub for Biomanufacturing, the Global Health Emergency Corps, the Interim Medical Countermeasures Network, and more. So all this has been established based on the lessons learned. And as I mentioned earlier, member states have committed to concluding negotiations on the pandemic agreement in time for this year's World Health Assembly. Finally, the executive order says WHO has an inability to demonstrate independence from the inappropriate political influence of our member states. As a UN agency, WHO is impartial and exists to serve all countries and all people. Our member states ask us for many things, and we always try to help as much as we can. But when what they ask is not supported by scientific evidence or contrary to our mission to support global health, we say no politely. And you have seen me doing that many times. As member states know, that's what we have done on several occasions to countries of all income levels in all regions. Honorable ministers, dear colleagues and friends, even before the US announcement, WHO is facing a shortfall due to the economic difficulties that many countries are facing. For many months, the regional directors and I, with the support of senior management, had been working with twin strategic goals: to mobilize new resources and to tighten our belts. The US announcement has made the situation more acute, and we have announced a set of measures with immediate effect to protect our workforce to the greatest extent possible. We're conducting a strategic alignment of resources with activities. We're freezing recruitment except in the most critical areas. We're significantly reducing travel expenditure, and we're looking to renegotiate major procurement contracts and reduce capital investments. More measures will be announced in due course. Our main objective is to protect our most important asset, our people, the dedicated, talented professionals who today are working around the world to help the people we serve to breathe clean air, eat healthier diets, drink safer water, and use safer roads. And they are working to help people get the safe, quality health services and products they need, where and when they need them, without worrying about what it will cost. And they're working to stop outbreaks and deliver life-saving care in the most difficult and dangerous situations. In short, they're committed to promoting, providing, and protecting health. And I'm proud to call them my colleagues. And together, we remain committed to the vision that you, our member states, had almost 77 years ago. The highest attainable standard of health, not as a luxury for some, but a right for all. I thank you.
Thank you, Dr. Tedros. The floor is now open for discussion. Kindly raise your nameplate should you wish to take the floor. You said Cameroon? Cameroon. You said Cameroon. Sorry, too. I give the floor to Brazil.
Mr. Director General, Mr. Chair, members of the Executive Board. In this challenging year, Brazil reaffirms its traditional position in support of multilateralism as a fundamental drivers for the well-being of our people. In this regard, we emphasize the need for sustainable and predictable funding for WTO. Brazil hosted an event on WTO's investment round during the G20 Leaders Summit last November. During Brazil's G20 presidency, Health Minister endorsed the creation of the Global Coalition, a strategic initiative to foster innovation and local and regional production necessary for the development and access to health technologies. Brazil will propose a following upside event on the coalition during WHA. In this regard, we commend South Africa for this year's G20 presidency and for the priorities outlined, which are closely aligned with Brazil's vision for health. Mr. Director General, we must prioritize in our countries equitable, integrated, and high-quality health services based on digital technology and continuously training and retaining the health and care workforce. Additionally, we must strengthen social participation as they understand the reality of the most vulnerable population. The Brazilian Universal Health System highlights its family health strategy, and you can support the Secretariat in prioritizing this agenda. We must work together on all the topics we will discuss in this EB, including discussion on UHC, non-communicable disease, health emergency PPR, climate change, health and care workforce, mental health, and strengthen regulation on the digital marketing of breast milk substitutes. Brazil is committed to climate and health agenda. And during our G20 presidency, ministers agreed on the historic health ministerial declaration on climate change, health and equity, and on One Health. The Brazilian Minister of Health will emphasize the discussion at COP30 and during a side event on WHA. The current Brazilian strategy puts together universal access, local production and innovation, and climate change placing health as a key area of sustainable development. Finally, I want to emphasize the Brazilian commitment with peace, science, democracy, sustainable development, and health as a human right. Thank you very much.
Thank you, Brazil. I now give the floor to sorry, I just saw Senegal. No, I'm seeing Canada. Sorry, I now give the floor to Canada to be followed by China.
Thank you very much, Chair. Thank you very much, Dr. Tedros, for your comments. The WHO is central to the global health architecture and serving a core role of stewarding multilateral cooperation in health and convening member states to set the common ground of global health agendas grounded in science and evidence. The world needs an effective, accountable, inclusive, and well-governed WHO, and we are here with you to support these efforts. Indeed, the hard work over recent years to strengthen organizational integrity, transparency, and accountability is recognized, and this must be maintained. Reform of the organization, of any organization, never stops. Workplace well-being is essential, as it is in any organization, and an organization's future success are predicated on this. There's a reason why we're all advised to put on oxygen masks first before helping others. To fellow member states, we are here to return to first principles. We're here to strategically guide the organization so it can implement the direction and priorities we set and deliver what we want it to do. This should be driving our actions and our interventions. We have an imperative to continue to work on giving the organization a single set of clear instructions. Splitting our energies across multiple resolutions doesn't help us. This may drive the work forward on specific issues, but is leading to a piecemeal approach, putting additional competition on resources and undermining the drive for efficiency gains. And yet these resolutions are all rightly premised on the same fundamental approach: promotion, prevention, treatment, rehabilitation, palliation, delivered on partnership with our communities, guided by strong evidence, and implemented via primary healthcare approaches in strong health systems. Let us continue to give our overall guidance and signal our priorities in a consolidated a fashion as possible through our core governance documents of the GPW and program budget. Thank you.
Thank you, Canada. I now give the floor to China, to be followed by Chile.
Thank you, Chair. Dear colleagues, the Chinese delegation wishes to thank the DG for the report. We commend the Secretariat for its long-standing efforts in coordinating global public health emergency responses, advancing UHC, and promoting governance reforms at the WHO. Diseases know no borders. Humanity constitutes a close community of shared future. At the national, regional, and global level, we must jointly shoulder the responsibility of safeguarding global health security. At present, the gap between developed and developing countries in accessing equitable and affordable health services remains significant. The most vulnerable populations still face many difficulties in obtaining essential health services. In this regard, China has always firmly supported the multilateralism and the WHO in playing a central leading role in advancing health equity. Simultaneously, it is hoped that the WHO Secretariat further enhances its work efficiency, focuses on its core responsibilities, continuously improve transparency and accountability, increase the representation of developing countries with more efforts, and involve more experts from these nations in WHO's work. Additionally, China hopes that the WHO can further define performance indicators for the cost effectiveness in the use of member states' contributions and promote member states-led, more open, transparent decision-making so as to better advance the health sector in developing countries and to ensure the timely achievement of health-related goals of the 2030 SDGs. China is willing to continue strengthening communication cooperation with all parties, further improve governance and reform process of the WHO, and advance the building of inclusiveness and equity of global health, and advance the building of a community of shared future for the human health. Thank you.
Thank you, China. I now give the floor to Chile, to be followed by Ukraine.
Thank you very much, Chairman. Chile is grateful to be able to participate in this session of the WHO Executive Board and be part of a dialogue on the global health challenges which we all face. Our government supports the work being done by the World Health Organization as the guardian of global health. And we would like to underscore the importance of international cooperation, which is fundamental for the well-being and full development of individuals. We would like to reiterate our commitment not to leave anyone behind and put all our abilities available to the organization to tackle communicable diseases, non-communicable diseases, expand universal health coverage, and refer to and tackle or help to tackle emerging challenges and international health emergencies. We recognize the need to adapt the governance of the World Health Organization to current changes. We appreciate the work the organization has been doing on this and the transparency in respect of necessary reforms. Chile would like to reiterate our support to multilateral dialogue and health policies to support the health of all individuals wherever they may be. Thank you.
Thank you, Chile. I now give the floor to Ukraine, to be followed by the Maldives.
Thank you, Chair, for the floor. Chair, Directors General, Excellencies, colleagues. On behalf of Ukraine, I would like to express my sincere gratitude for the critical priorities highlighted in your report. We are deeply concerned about the potential impact of possible changes to WHO's membership and funding structure, and remain mindful of the broader consequences for global health initiatives. Since the Russia full-scale invasions of Ukraine, WHO actions implemented in close collaboration with key partners have played a crucial role in emergency response, humanitarian aid, and strengthening the resilience of Ukraine's healthcare system. These efforts have been both visible and effective, and for this we are profoundly grateful. Dr. Tedros, Ukraine continues to fight for its future. The ongoing war affects millions of lives, making WHO's unwavering support essential in ensuring access to medical care and preserving human capital. This support is not only vital for Ukraine, but also for stability of the European region and global health security. It must be continued. At the same time, Ukraine remains committed to rebuilding its medical infrastructure and restoring the healthcare sector. A process is already underway in partnership with the international community. Even after the war ends, sustained collaboration will be necessary to ensure long-term recovery and resilience. Thank you, Dr. Tedros, for your leadership, your dedicated and your steadfast support for Ukraine. Thank you so much.
Thank you, Ukraine. I give the floor now to Maldives, to be followed by Cameroon.
Honorable Chair, Director General, Excellencies, distinguished delegates. The Maldives extends its sincere appreciation to Director General Dr. Tedros and his team for their insightful report and steadfast leadership in addressing global healthcare challenges. The past few years have been turbulent, presenting unprecedented challenges to global health and the WHO, from the COVID-19 pandemic to the multiple health emergencies against a backdrop of geopolitical tensions. Despite these difficulties, the WHO has not only supported member states, but also effectively implemented much needed organizational reforms. The reorientation of WHO programming through successive general program work initiatives has been pivotal. The Maldives is encouraged by the prioritization of critical areas under GPW 14, including climate change and health, mental health, health emergencies, injury prevention, and health equity. These areas are particularly important for small island developing states like the Maldives. Guided by GPW and aligned national, regional, and global policies, the Maldives has made significant strides toward health equity, ensuring no one is left behind. Given the geographic isolation of our island communities, accessible healthcare closer to home is paramount. Our primary healthcare initiative shows great promise as PHC remains the foundation for achieving universal health coverage and strengthening health systems. Despite these achievements, significant challenges remains. Non-communicable diseases, mental health issues, and emerging public health threats continue to strain our fragile health system. Global warming, rising sea levels, and associated flooding contribute to the spread of vector-borne diseases, posing significant threats to our healthcare systems and the well-being of our communities. We urge fellow member states and the WHO to support climate-vulnerable countries in mitigating these climate-related hazards and their impacts. The Maldives welcomes the WHO's strong focus on global health security. As discussions on the pandemic agreement progress, it is essential to ensure inclusivity, prioritize vulnerable populations, and uphold the principles of equity and solidarity. As we participate in the next high-level meeting of NCDs, we recognize the WHO's leadership in tobacco control under the Framework Convention on Tobacco Control and the critical link between tobacco use and the chronic diseases. Recognizing the devastating impact of tobacco on health and communities, especially young people, the Maldives has taken decisive measures, including a comprehensive ban on e-cigarettes. As the WHO and global health face new geopolitical realities, we must remain steadfast in safeguarding the health and well-being of our communities worldwide. The Maldives reaffirms its commitment to achieving our shared vision for global health. Through concerted action, resilience, and collaboration, we can build healthier populations and stronger health systems for generations to come. Thank you very much.
Thank you, Maldives. I now give the floor to Cameroon, to be followed by Micronesia.
Merci, Monsieur le Président.
Thank you, Chair. Chair, the Republic of Cameroon
has the honour of making this statement on behalf of the 47 countries within the African group. We congratulate the Secretariat of WHO for the dynamic work that it does. We also thank the Director General for the comprehensive report submitted to us, and we reiterate our support for him in his endeavours. Chair, the African Group wishes to thank the Director General for all of his work and the significant achievements made in the course of 2024. In the wake of the COVID-19 pandemic, health and well-being are of increasing importance today, and the demand for health services is continuing to increase, with calls for a more holistic, inclusive and equitable approach being taken to health. Also appeals to ensure that health and well-being guide humanitarian, economic and development programs. This is particularly important in the light of emerging communicable diseases as well as re-emerging diseases, also the growing burden of neglected tropical diseases, NCDs, hunger and climate change. The ongoing increase in the debt burden in all countries, particularly in sub-Saharan Africa, further compromises the ability of these countries to invest more in their health systems and hinders progress towards achievement of the SDGs by 2030. We note that recent ongoing progress has been made when it comes to technology, digitization and AI. Also behavioral sciences, fundamental sciences, translational sciences, and all of these things provide opportunities to make further improvements and to accelerate progress when it comes to health and well-being for all. Nonetheless, given the differences in digital and health structure between countries, even these new technological advances may deepen inequalities. We recognize and appreciate the leadership of the Director General in making positive progress in the African region, and we thank the DG for having presented to us progress made in the course of the past year with reference to the 5 key pillars. Strengthening primary health care in order to achieve UHC remains important for our region. African member states fully support conclusion of the negotiations on a pandemic treaty. This is something that will be considered by the WHO in May this year. We reiterate the fact that we believe that this treaty should be equitable, focus on innovation and technology, access to medical products, human resources, and on health and funding and financing issues. Chair, we welcome the proposed programme and budget 2026-27, and we note, however, with concern the significant reduction in the base segment. That being so, we support the 20% increase in assessed contributions, but we very much recommend that budgetary allocations be undertaken in accordance with priorities ranked by countries. There can only be significant achievement in this area if we have close coordination with national health authorities and support for them. This is the kind of approach that will allow us to achieve the goals of GPW14 while meeting expectations that exists when it comes to all of the work that we are doing. We wish to ensure the Director General of our full support in moving towards achievement of all of the elements of the GPW when it comes to health in accordance with the priorities that have been agreed. Thank you.
Thank you, Cameroon. I now give the floor to Micronesia, to be followed by Barbados.
Honorable Ministers, colleagues, ladies and gentlemen, Federated States of Micronesia thanks and appreciates the report from the DG. It's clear the WHO has made difference and achieved impacts at country level. It takes financial and human resources, access to technology, but more importantly, cooperation among the global family to deliver success. The WHO has been able to uplift countries to reach new heights in reducing mortality, setting standards, controlling deadly outbreaks, making life-saving vaccines affordable, and supporting countries in implementing new guidelines, and the list goes on. This is not to say that the WHO does not need improvement. It's a statement of appreciation for the work of the WHO to stand up for the most vulnerable, responding to outbreaks where country capacity is limited and geographic isolation impedes access. Clearly, the WHO is technically and morally fit for this purpose. In the coming days, the WHO must make difficult choices by prioritizing its program of work. I hope and pray the WHO does not lose sight of the importance of being the guardian or voice of the most vulnerable.
those with greater health disparity and in greater need. Lastly, Mr. Chair, we support a 20% increase in AC contribution. Thank you.
Thank you, Micronesia. I now give the floor to Barbados, to be followed by the Democratic People's Republic of Korea.
A special thank you to the chair of the EB, Dr. Jerome Walcott, Director General, distinguished colleagues. Barbados expresses its deep appreciation for the report of the Director General Tedros. Your careful listing of achievements gives member states the comfort that WHO remains extremely relevant in our changing world. The ambitious agenda of over 20 resolutions and 47 agenda items, we are sure that collaboration and solidarity, we can accomplish the goals and objectives of the 156th Executive Board. Barbados remains concerned that in a new geopolitical climate, the role of the WHO must not be diminished or sidelined. Assessed contributions and voluntary contributions need a fundamental review, along with prioritization of programmatic areas, particularly for the region of the Americas. The 70% reliance on voluntary contributions needs to be relooked and renegotiated. The investment round agreed by WHO is more critical than ever. One of the Pan-American Health Organization strategies is to increase and improve the governance and technical capability of country offices. This must continue. Program budgets must be more responsive to individual member states, and Barbados is willing to be part of a review to increase its assessed contributions by 20%. Prioritization of needs as it relates to small island developing states must include responses to non-communicable disease and mental health, antimicrobial resistance, sustainability of the health workforce, responses to health emergencies, climate change, and digitization in healthcare. Barbados will continue to play its part as we chart new courses for public health in an uncertain global environment. I thank you.
Thank you, Barbados. I now give the floor to the Democratic People's Republic of Korea, to be followed by Senegal.
Thank you, Mr. Chair. DPR Korea would like to thank you, WHO DG, for the report outlining the achievement made by efforts of WHO and member states. We also commend the outstanding efforts and leadership by DG and his team to protect, provide, and promote the health of the people globally. In line with the overall mission of health for all, no one behind the left. We could identify many success stories in responding to emerging health challenges and conducting the investment round for sustainable financing for GPW14. In DPR Korea, building the county hospitals equipped with advanced medical instruments and supplies is being pushed ahead as per the government new regional development policy, which is aimed at providing the more affluent, healthy, and well-being to all local people living at counties of the country in coming 10 years. It will definitely bring remarkable achievement with a contribution to improvement of UHC and PHC in the country. WHO is recently financing. WHO is recently facing financial constraints, which will make it more challengeable for WHO program, in particular for the next biennium, 2026 to 2027. It will be more challengeable for WHO in the next biennium, 2026 to 2027, with the financial and economic conditions. However, now that there is the strong commitment to increase aid made by all member states and potential instrument to secure and mobilize more resources, as well as able excellent leadership of the WHO Director General, we are sure that will be very forward. As you know, challenges bring another opportunity for turning adversity into favorable conditions. We suggest Secretariat to take the accountability to address the financial constraints in more active, transparent manner with the engagement of various donors and stakeholders as well as member states. We also call for all member states to strengthen the solidarity with WHO for providing healthy life and well-being of the people in their country. And DPR Korea, as a WHO member status, is committed to actively participating in global health improvement. Thank you.
Thank you, Democratic People's Republic of Korea. I now give the floor to Senegal, to be followed by Poland.
Thank you very much, Chairman. Director General, Secretary, Ministers and representatives of delegations, Senegal would like to endorse the statement made by Cameroon on behalf of the 47 member states of the African region, and we should like to thank the World Health Organization and the Director General and congratulate them on all the efforts they have made to promote global health. WHO is now facing difficulties in respect of resource mobilization, and the recent decision of the United States of America to withdraw from the organization is not going to make things any simpler. In the face of what is a difficult situation, Senegal would like to propose that we mobilize health diplomacy around the world to urge the United States to change its decision given the efforts that it's been asking WHO to make and which it has already made. Discrepancies in access to health care between people around the world is not just a question of health or of money. Indeed, it's a question of health security, and that affects the United States as much as anyone else. The United States cannot really remain outside the global health policy being implemented by the World Health Organization. We urge the Executive Board to take a constructive and sincere initiative to talk to the U.S. authorities, including the U.S. Congress and the Senate, to encourage the country to remain within WHO and to urge other countries to think about the legacy that all of us, with no exception, are going to leave to future generations. Thank you for your attention.
Thank you, Senegal. I now give the floor to Poland, to be followed by Norway.
Thank you, Chair. Chair, Director General, Excellencies, colleagues. I am delivering this statement on behalf of the European Union and its 27 member states, the candidate countries, Georgia, Montenegro, Macedonia, Republic of Moldavia, align themselves with this statement. Every human being has the right to the highest attainable standard of health. The EU thanks the Director General for the report and commends WHO's tireless efforts to achieve SDG 3. The EU reaffirms its strong commitment to WHO in these challenging times. International and regional cooperation complements national action. Inclusive collaboration ensures no one is left behind. A common agenda is increasingly important in the face of growing health challenges and constrained financing. The announcement withdrawal from WHO, expressed by the organization's single largest donor country, may have an impact on the organization's financing amid WHO's growing actions. Predictable funding is vital for WHO to plan effectively and fulfill its mandate. We urge all stakeholders to focus on the WHO's comparative advantages and support WHO financial flexibility and predictability while prioritizing core functions and strategic objectives. The cost implications of new actions must be assessed to ensure continuity of essential programs. Addressing determinants of health is crucial to promoting health and preventing disease. Non-communicable diseases, including those with low prevalence, must remain high on the agenda, particularly with this year's UN high-level meeting. Mental health, especially for children and youth, requires urgent attention, particularly given the impact of conflicts. AMR and climate hazards are severe global threats that require coordinated response through the One Health approach. In an interconnected world, global health security is critical. The COVID-19 pandemic exposed health system vulnerabilities, while the Mpox emergency underscored the need for vigilance. The WHO Pandemic and Epidemic Intelligence Hub and the European Surveillance System provide vital guidance. The EU and its member states remained committed to a successful conclusion of the INB negotiations. The adoption of the IHR amendments at the 77th WHA provides a solid basis for future work. The EU deplores the rising number of health emergencies caused by armed conflicts, resulting in devastation in Ukraine, in Middle East, the DRC, Sudan, Yemen, and elsewhere. We commend WHO's life-saving work and call on all parties to uphold international humanitarian law, protect health personnel and facilities, and respect humanitarian principles. To achieve SDG 3, amid climate change, we need robust health systems, prioritizing prevention, health promotion, and primary health care. Equitable access to essential services and gender equality are vital for universal health coverage. The EU remains committed to the promotion, protection, and fulfillment of all human rights, and to the full and effective implementation of the Beijing Platform for Action and the Programme of Action of the International Conference on Population and Development, ICPD, and the outcomes of their review conferences, and remains committed to sexual and reproductive health and rights in this context. Research and innovation, underpinned by appropriate governance, ethical standards, and equitable access, are key to developing affordable medicines, treatment, and technologies, including responsible AI use. A skilled and motivated health workforce is critical for quality healthcare and resilient health systems. The EU supports WHO's efforts, such as the WHO Academy, to improve workforce planning, education, and working conditions. Recognizing WHO's leadership in developing evidence-based standards and guidelines, we are concerned about the recent politicization of discussions, which detracts from WHO's essential work. We urge all member states to prioritize public health. With appreciation for the development of GPW14, the EU and its member states remain committed to working closely with WHO and partners to build a healthier future for all. Thank you very much.
Thank you, Poland. I now give the floor to Norway, to be followed by Israel.
Thank you, Chair. We thank the Director General for his report and express our gratitude to all WHO staff for their tireless work. The most important task for this executive board is to support the organization in making difficult but necessary prioritizations and to preserve the functions only WHO can provide and the support WHO provides to countries. We support the PBAC's recommendation of a realistic program budget for 2026-27, including the scheduled 20% increase in assessed contribution. We urge the EB to do the same. Further reform towards more transparency, accountability, and efficiency is necessary to create trust. And as the premise for flexible and predictable financing. Adopting the procedures for potential allegation against DGs at the Health Assembly 78 is an important step. Member states also need to take responsibility. We need to rethink the way forward to improve the efficiency of the governing bodies. The right to health cannot be achieved without universal health coverage. Underpinning the sustainable financed health system with a focus on primary health care, ensuring access to preventative and integrated services, including sexual and reproductive health and rights, is essential. To end, we are extremely worried about the increasing attack on health facilities as we have seen in Gaza, Sudan, and Ukraine. This is completely unacceptable. Hospitals and health facilities must remain safe havens for patients and health workers. Thank you.
Thank you, Norway. I now give the floor to Israel, to be followed by Ethiopia.
Thank you, Chair. Israel welcomes the Director General report. I'll drop my written message and I would just go to the main point of the week in our eyes, and that is a withdrawal of the United States, which is not just a budgetary issue as by some members could be understood the main problem. The main problem is not the budget. The budget is a huge problem, but still leaving this organization, the most relevant health organization in the world, and avoiding a domino effect of other states, not necessarily withdrawing, but rather losing interest in this organization and as well international other international bodies, companies, industry, academia. In the sake of this organization, we must find the route to have a, I would say, a productive discussion with our American colleagues and see if there is a path to revise their decision and how to go and take the next steps. In our eyes, there are 5 pillars for this discussion. We have to speak about accountability in all levels. We have to speak about budgetary issues, and I do believe that PIVAC did a great job, and here we'll have a chance to further discuss the budget. But we really have to show that we have clear budgetary reforms in front of us. Structural reforms were widely discussed, and indeed during the last 7 years, the current Director General did lead a structural reform in the organization, but much more should be done, and that include focusing of this organization to its core functions, mostly in public health emergencies and other health issues where there's nobody else to take the beacon ahead. We have to be more exclusiveness. We have to depoliticize, much depoliticize in order to look a professional organization, a professional agency, which can take the world for a better place in sense of health. The last issue, which was not mentioned here today enough, is the issue of disinformation, of misinformation. We must tackle in a much better way this issue, because there's a wide campaign against public health, against this organization, against vaccination in many of our societies. It is not only for rather professionals, but also for the wide public and our politicians. We have to explain better who are we and what is the future and what are our plans to facilitate this future. Thank you.
Thank you, Israel. I now give the floor to Ethiopia, to be followed by Bulgaria.
Thank you, Chair. Ethiopia Airlines was the regional statement delivered by Cameroon on behalf of the 47 member states of the African region. We also thank the Director General for the chairmanship and also for the comprehensive report. We have taken note of the achievements and the challenge and the continuous evolving political dynamics that this has been bearing in our discussions and the discussions to come over the days. Ethiopia has been working with WHO and other partners to ensure that healthy and prosperous society with a focus of primary health care, service integration, and also addressing social determinants of health and well-being. However, a multifaceted challenge with increasing triple burdens of the disease has been increasing significant challenge in health system strengthening and health resilience over the years. And this also adds to misinformation as an additional challenge that our globe is facing now. We deem enhanced collaboration and support, especially in equitable access to health products, local manufacturing, strengthening health and workforce, health financing, primary health care as very crucial, and requesting enhanced support with a focus of strengthening country capacities. We believe that we are at critical junction to redefine our global health, emphasizing that health is at the investment of significant contribution for economic growth and achieving SDG. WHO's role as a scientific and evidence organization and its role in setting global norms and standards and supporting this adoption and implementation of impacts in countries and is becoming more important more than ever. Ethiopia has been supportive of efforts to have sustainable, predictable, and flexible financing to WHO. And we call upon all member states to support the investment round and honor a collective commitment of increasing access contribution. We view the recently amended international health regulation and the pandemic agreement as an important milestone for global health security and health system resilience. We also urge all member states to accelerate implementation of the IHR, but also finalizing negotiation of the pandemic agreement with a view of adoption possibly by 2025. Ethiopia stands ready to strengthen collaboration and partnership in health and looks forward for fruitful discussion in this EB week. I thank you.
Thank you, Ethiopia. And I'll give the floor to Bulgaria, to be followed by Brunei Darussalam.
Thank you, Chair. Distinguished Director General, Excellencies, Bulgaria aligns with the statement on behalf of the European Union and its member states. Today's world is an arena of multiple crises affecting health, which shape complex hazards that go beyond the scope of national governments and require consistent and effective preparedness and concerted response actions across sectors and borders. While we are highly concerned about the rising number of health emergencies, we commend the courageous work of WHO in saving lives and alleviating human suffering. Bulgaria considers health security a major priority, along with building core capacity and developing fit-for-purpose national health systems. Bulgaria actively participates in the INB negotiations, and we still hope to achieve consensus on meaningful provisions with added value. However, addressing global health threats and multilateral actions should not duplicate initiatives and avoid unnecessary overlap, especially in time of limited resources. We acknowledge the necessity to secure sustainable funding for WHO global health functions. Bulgaria considers that WHO budget should reflect the link between global health priorities and the expected outcomes toward achieving better health and well-being for all. Performance indicators for budget programs need to provide an objective assessment. In view of recent developments related to withdrawal of major contributor, a strict financial discipline is required to strengthen monitoring and accountability. We welcome WHO efforts to reform its governance. We call for closer coordination with governments on domestic health challenges to better address their needs and enhance country impact. Strengthening the effectiveness of WHO governing bodies calls for strict agenda and time management, along with introducing housekeeping rules to optimize their work, which will remain available to support. Similarly to other health systems globally, the Bulgarian healthcare system as well continues to struggle with an aging workforce in the health sector, insufficient attractiveness of some health professions, uneven territorial distribution, migration of health workers. We recognize and support WHO targeted actions to ensure an effective, well-trained, motivated and protected professional healthcare workforce. Among other critical issues we identify as key, the MRR, mental health and climate change, which need an urgent international response to prevent further devastating impact. Bulgaria remains committed and stands ready to support WHO in addressing these challenges and continue collaborating with the organization and its member states for better health for all, targeted at tangible results, mindful of the specific national context. Thank you.
Thank you, Bulgaria. I now give the floor to Brunei Darussalam to be followed by the Republic of Korea.
Thank you, Chair. Bismillah ar-Rahman ar-Rahim. Assalamu alaikum wa rahmatullahi wa barakatuh, and a very good morning. Chair, Excellencies, delegates, ladies and gentlemen. Brunei Darussalam wishes to congratulate the Director General and the Secretariat for their steadfast leadership and tireless efforts in navigating complex global health challenges. We take note of the extensive report provided by the Director General. The discussions at the 77th World Health Assembly last year highlighted critical priorities, many of which remain central to our agenda today. From addressing the persistent threat of pandemics and strengthening preparedness under the international health regulations, to advancing universal health coverage, combating non-communicable diseases, and mitigating the health impacts of climate change, these are the shared challenges that demand collective action. Brunei supports the development of the Global Action Plan on Climate Change and Health. Climate change is not just an environmental issue, but a profound health crisis, as evidenced by its exacerbation of disease burdens and its disproportionate impact on vulnerable populations. We urge member states to accelerate efforts to integrate health consideration into climate adaptation and mitigation strategies, with strong technical and financial support from WHO. Similarly, the alarming burden of NCDs, coupled with growing mental health challenges, requires urgent attention. Brunei commends WHO's leadership in advancing various NCD initiatives, including those targeting cervical cancer and mental health. We believe these programs must remain at the forefront of global health priorities, supported by sustained funding and innovative partnerships. Brunei also commends the WHO for its exceptional work under the Health Emergencies Program, which continues to save lives in some of the most challenging contexts. The unwavering commitment to delivering health services to those affected by emergencies and disasters reflects the essence of WHO's mission. In this regard, we emphasize the urgent need to address the humanitarian crisis in the Gaza Strip and other areas of conflict. The health system have been disseminated, and rebuilding them are essential to ensure access to basic life healthcare and basic life sciences service. We urge all nations to uphold the principles of humanity and solidarity and to strive for lasting peace, as it is the cornerstone of health and well-being for all. Chair, ladies and gentlemen, as we look to the future, it is imperative to reaffirm our commitment to solidarity and multilateralism. While we recognize the diverse circumstances of member states, we firmly believe that global health can only be safeguarded through unity and shared responsibility. The WHO remains the cornerstone of the global health governance, and its strength lies in our collective contributions, guided by equity and compassion. Brunei reiterates its commitment to fostering global solidarity and ensuring that no community is left behind in our collective efforts to safeguard health security based on the principles of equity, solidarity, and resilience. Thank you.
Thank you, Brunei Darussalam. I now give the floor to the Republic of Korea, to be followed by Australia.
Thank you, Chair and DG Tedros. The Republic of Korea, as an executive board member, is attending this board meeting with a strong sense of responsibility to help WHO better manage our crisis at a time when WHO is facing financial pressures. The ROK is confident that GPW14 will mark a turning point for significantly advancing SDGs, including UHC achievement by 2030. As the progress of UHC-related indicator was somewhat hindered during a COVID-19 response, it is a critical task to bring it back on track. Additionally, we believe that active cooperation among member states is required to tackle emerging health threats such as chronic disease, mental health, and climate change. Currently, the ROK is domestically undergoing 4 major healthcare reform initiatives to address health risks, including insufficient and imbalanced medical infrastructure. In specific, we will expand the healthcare workforce, establish a comprehensive community healthcare delivery system, enhance reimbursement for essential medical services, and fortify the safety net against medical malpractices. In addition, the ROK will join the effort to strengthen the global health for effective future pandemic PPR. And we will be actively engaged in the remaining INB meetings to establish a workable pandemic agreement that all member states agree on. During this executive board meeting, the ROK looks forward to discussing the WHO's fundamental mandate and core functions, and how we should prioritize WHO's work so that we can contribute to turning this crisis into an opportunity. Thank you.
Thank you, Republic of Korea. I now give the floor to Australia, to be followed by Lebanon.
Thank you, Chair. I'd like to cover off 3 issues: strengthen the global health system, health policy priorities, and the governance and sustainable financing of the WHO. First of all, with respect to strengthening global health security, we commend the WHO for its tireless efforts in responding to ongoing and increasing urgent health needs, including in conflict and humanitarian settings. One couldn't help but listen to the Secretary General's comments today about the breadth of activity of the WHO to realise how important that action on global health security is. The current H5N1 outbreak and Mpox fake are important reminders of the need to enact lessons and achieve better outcomes when responding to future emergencies. Last year's amendments to the international health regulations demonstrated what can be achieved when we work collectively. We encourage all member states to continue this momentum to secure the pandemic agreement. Board members here can play an important role in leveraging this momentum by guiding regional counterparts. Australia ourselves will continue the vital and open collaboration necessary to land a robust agreement, particularly through our INB Bureau Vice Chair role. On health policy priorities, the 2030 Agenda for Sustainable Development and the GP14 work program lay strong foundations for our shared goals. Australia welcomed WHO's work to support member states in reorienting health systems towards primary health care. This is the cornerstone of universal health care and the most equitable and efficient path to achieving universal health care by 2030 under SDG 3. In concert with Poland, Australia is a long-standing supporter of sexual and reproductive health and rights for everyone, everywhere. With respect to governance and sustainable financing, I note the comments by our Canadian colleague about the breadth of resolutions before us and our colleague from Norway urging us to be able to prioritise. I think the conversation about governance and financing really has talked about three topics. One, how we look to resource mobilisation, particularly in the context of the current challenges. Two, how we can drive further efficiency in the WHO. And three, how we can do prioritisation. With respect to this last part, including that comment about new resolutions, I welcome the comment by the EB Chair, reflecting on yesterday's informal retreat, about the possibility of the Secretariat bringing forward advice to the meeting in May, the WHA, on the way forward. I think it would be very good if this advice could deal systematically with three key topics. One, a clear articulation of the decision rights of the various bodies, players and member states, with a clear recognition that this is a member state-driven organisation where ultimate decision rights must rest. Secondly, clear guidance on the form of transparency and the issues that need to come forward to provide guidance. These include clear proposal, clear costings, clear indication of sources of finance, gaps, and the alignment with GWP 14. And finally, clear guidance on the process and timing to ensure that we have a member state-driven process. Finally, Australia provides long-term flexible voluntary funding. To reach the full potential of member state-led sustainable financing agreement, it is important that we achieve an increase in assessed contribution by member states to ensure critical programs are funded. We must ensure WHO can play the role that only it can and that the world expects of it. Thank you, Chair.
Thank you, Australia. I now give the floor to Lebanon, to be followed by Thailand.
Thank you, Mr. Chair. Honourable Ministers, colleagues, ladies and gentlemen, Lebanon commends the Director General's report that details the outstanding achievements of WHO over the past year, despite increasing needs, challenges and threats. And this is no news, as we are all used to the many achievements of WHO. We are now more than ever in need of more solidarity, of stronger commitment to global health, as well as to the right to health and to human rights at large, and to bring the best of this organization's 77 years of commitment to improve our population's health. It goes without saying that WHO needs more resources to achieve the health programs in view of the global challenges, including acute emergencies that the world is facing. Accordingly, we support now more than ever the increase in assessed contributions according to the previously agreed timelines. We are now faced with an expected WHO budgeting gap that compels us to find innovative solutions. We would like to see difficult circumstances as an opportunity to innovate and to grow. Improvements should be dynamic and never stop. It is a journey rather than a destination. What is important above all is to be able to sustain the improvements that we all invested in over time. The advancement in medical technologies necessitates a dynamic approach in human resources, in data and innovation, and in innovative financing. With more physical and mental health threats we are facing, including conflict-driven disasters, climate change, and other such drivers, prevention and preparedness to emergencies remain the best approach. Though we support the restructuring that you are intending to do, we urge us all to safeguard WHO's role and mandate in the global health system in our ever-complicated world. With the increase in needed resources and the scarcity of these resources worldwide, we believe that it is not wise to disaggregate the world's funds under many names and umbrellas. We grant WHO our full support as our world needs WHO now more than ever. Thank you, Chair.
Thank you, Lebanon. I now give the floor to Thailand.
Thank you, Chair. Thailand would like to say thank you, and thank you. Thank you 3 times to the DG and the Secretariat for their hard work with concrete results. We will not thank or commend the Secretariat again throughout this EB to save time. Chair, Thailand wants to see the WHO walks more of its talk. The WHO recommends that there is no safe limit of alcohol. Strongly recommend. But last night, at the reception, at the dinner for the executive board retreat, wines were served, which I also drank, as it is served free. Chair, 4 regional offices have stopped serving alcohol to show their leadership, and Thailand would like to see the headquarters follow their track. We will definitely say thank you, thank you, thank you, and thank you 4 times if this practice becomes the norm throughout the WHO offices. Thank you, Chair.
Thank you, Thailand. I see no further requests from the board to speak, so I now move to the member states that are not members of the board, and I give the floor to Spain to be followed by France.
Muchas gracias.
Thank you very much, Chairman. Spain would like to endorse the statement made by the European Union. We're sincerely grateful to the Director General for having submitted a very detailed report. Thank you, Dr. Tedros. We'd also like to thank all the staff of the World Health Organization for their hard work on a daily basis. As member states, we must all strengthen the authority of WHO as the core agency responsible for global health and guarantee her the resources necessary to do her work. All of us are aware that we're facing many different challenges which require a coordinated response. NCDs, mental health, antimicrobial resistance, neglected tropical diseases, polio eradication, and the impact of climate change on health are just a few examples. Approaches such as One Health and health in all policies are essential if we are to tackle these threats in an effective manner. Turning to equity, achieving universal health coverage through strengthening primary health care and community health, and focusing on policies which take into account the social determinants of health is essential. As a country committed to a feminist foreign policy, we believe that all health policies should include a gender aspect with coverage of both sexual and reproductive rights. We also urge member states not to forget the consequences of a lack of international coordination on preventing, preparing for, and responding to health emergencies. We urge a successful outcome to an international pandemic treaty which is both ambitious and fair. Global health cannot be endangered by political, economic, or religious interests. It's a fundamental right and must remain a priority on our agendas. We urge all member states to step up their commitment to and with WHO and health multilateralism for a more healthy, fair, and resilient future for everyone. Thank you.
I'll give the floor to France to be followed by Denmark.
La France.
Thank you. France wishes to align itself with the statement delivered on behalf of the EU and its member states. We are indeed at a turning point in terms of the crisis raging in the world today. We need more than ever a strong, legitimate and effective WHO, and France certainly will do its utmost to support the organisation, its teams and its Director General, Dr. Tedros. WHO remains a normative benchmark for public health. That is a key role that it plays, and it's something we must continue to defend. As things stand today, we have a historic opportunity to adopt an ambitious international instrument on pandemic prevention, and we would call upon all member states to do as much as they possibly can in order to ensure that this decisive instrument can enter into force and that prevention can be given its due place. We recall the fact that health emergencies are no longer indeed restricted to pandemics. Look at the cyclone that took place recently, and we saw the emergency that caused, and I would like to thank WHO for their support in that event. We need to anticipate better and to build better the resilience of our system so that we can overcome challenges that we face today and in the future. If that is to happen, then WHO needs resources so it can be sustainable in the long term. We continue to support ambitious reform of funding for WHO, which is an organization that must not be weakened, because if it was weakened, then the health of all is endangered. We support in particular training. We know that WHO has a new tool, that is to say the Academy in Lyon, that can contribute to training ambitions. We have supported the establishment of that Academy, and we call on all member states to support it fully. We have to make decisive choices. We need the WHO to play its role within the global health architecture. That is vital for our future, and we will continue to defend effective and solidarity-based health multilateralism so that we can have an effective international system where no region is left behind.
Go to Denmark, to be followed by the United Kingdom of Great Britain and Northern Ireland.
Thank you, Chair, Director General, dear colleagues. Denmark aligns itself with a statement made on behalf of the EU and the member states. The state of global health is severely challenged, not only because of numerous humanitarian and health emergencies that arise at what seems to be an ever-increasing speed, but also because the most important global health actor, the WHO, is facing a difficult financial situation that will require tough strategic choices. We deeply deplore the increasing number of human-made emergencies with immense impact on human health, in particular Russia's unprovoked, unjustified, and illegal war of aggression against Ukraine. We also reiterate our gravest concern about the deep humanitarian catastrophe in Gaza. War and conflict have fatal consequences for our health. In addition to the many direct victims, war and conflict bring destruction of hospitals, disruption of access to health services, and increasing mental health issues, to name a few. Our support for civilians and aid workers is crucial. Multilateral cooperation is increasingly important to secure the resilience and sustainability of our health system, and so is innovation. In Denmark, we recently passed a healthcare reform that introduces an entirely new structure and a redistribution of tasks. A significant element is better integration and equal prioritization of psychiatric and somatic healthcare. Strengthening healthcare system is of relevance across the globe, and the support of WHO is crucial in this regard. We remain fully committed to working with WHO to create a healthier future for all. Thank you.
Thank you, Denmark. I now give the floor to the United Kingdom of Great Britain and Northern Ireland, to be followed by Mozambique.
Thank you very much, Chair. The UK would like to thank the Director General for his report and commends the organisation and WHO staff for their unwavering commitment to championing health for all. The UK is proud of our long-standing partnership with WHO and are committed to supporting the organisation to deliver for today's health challenges. That is why the UK pledged £310 million in fully flexible funds in the investment round in November. Our funding will help to support the delivery of WHO's transformation efforts. We thank WHO for responding to numerous health emergencies over the past year, including the ongoing humanitarian crises in Sudan and Gaza, and the devastating impacts of Russia's illegal invasion of Ukraine. We commend WHO's rapid intervention in the outbreak of Marburg virus disease, releasing vital funds and supporting response teams, as well as in the current Ebola outbreak, and recognise the vital role of health system strengthening in better preparing for health emergencies. 2025 will be a critical year for protecting global health. The UK remains committed to improving global health outcomes for everyone and protecting global health security, including for a new pandemic accord, implementation of last year's high-level meeting declaration on AMR, and continuing to tackle the health impacts of conflict. We also remain dedicated to tackling NCDs. Domestically, the UK is set to create the first smoke-free generation. And internationally, we hope to secure strong consensus to agree actions at the high-level meeting on NCDs in September. The UK looks forward to continued collaboration and exchange with WHO and member states throughout this week and beyond, including on prioritisation efforts in light of WHO budget pressures. International collaboration is crucial for achieving our collective goal of health for all. Thank you, Chair.
Thank you, United Kingdom of Great Britain and Northern Ireland. I now give the floor to Lesotho to be followed by Mozambique.
Mozambique.
I'm giving the floor to Lesotho.
Thank you very much, Mr. Chair. I just raised my hand, so I think it's supposed to be Mozambique before Lesotho. Thank you.
No, you are a member of the EB, so you get precedence.
Thank you very much, Mr. Chair, Director General, Honorable Ministers, Excellencies, and distinguished delegates. The Kingdom of Lesotho expresses its gratitude to the Director General for his comprehensive report, which highlights the progress and challenges in global health for the past year. We commend the World Health Organization for its leadership in advancing universal health coverage, responding to health emergencies and strengthening health systems worldwide. Lesotho aligns itself with the statement made by the distinguished delegate of Cameroon on behalf of the 47 member states of the Africa region and wishes to highlight the following key areas. Universal health coverage. We acknowledge WHO for efforts in accelerating universal health coverage and emphasize the importance of primary health care as a cornerstone of resilient health systems. In Lesotho, we continue to implement policies that prioritize equitable access to quality health care, particularly for vulnerable populations in remote areas. However, we call for increased technical and financial support to strengthen our health infrastructure and human resources. And also health emergency preparedness and response. The COVID-19 pandemic underscored the importance of preparedness and response mechanisms. Lesotho supports the continued negotiations on the pandemic accord and amendments to the International Health Regulations 2005 to ensure a coordinated and equitable response for future healthcare crises. We urge WHO and development partners to enhance support for low and middle income countries to strengthen their public health emergency preparedness and capacities. And also non-communicable diseases and communicable disease. The burden of non-communicable disease alongside the persistent challenges of HIV/AIDS, tuberculosis, and malaria remains a significant concern for our country and the region. We appreciate WHO for the continued support in addressing these challenges and reiterate the need for sustainable financing mechanism to scale up prevention, diagnosis, and treatment efforts. Thank you very much.
Thank you, Lesotho. I now give the floor to Mozambique to be followed by Eswatini.
Thank you, Chair. Mozambique aligns itself with the statement delivered by Cameroon on behalf of 47 WHO African states. We would like to take this opportunity to thank this comprehensive report by the Director General, which fully reflects the work WHO work carried out around the world, particularly in developing countries and in those hardest hit by epidemics, natural disasters, armed conflicts, and humanitarian crises. Mozambique also takes this opportunity to express our gratitude to WHO support, particularly during the outbreaks of cholera, polio, and natural disasters related to climate change. In the last 3 months, WHO supported Mozambique in the response of 2 cyclones. As the Director General said, the WHO reaches where no one else, often putting the lives of its employees, including himself, at risk for the sake of saving those who desperately suffer and have practically nothing then can relieve themselves except through external aid. And this aid comes through WHO and is based on the support from member states and institutions of goodwill to whom we are very grateful. We all members shall make an effort to improve our contribution and mobilize more partners to allow WHO to accomplish its purpose to promote health, prevent disease, and save lives, particularly in the light of the current financial crisis. To accomplish the global health targets, including the 14 global program of work, Mozambique is working towards increasing its access contribution by 20% and making every effort to properly contribute to investment round. To conclude, Mozambique remains committed to work with other member states to conclude the pandemic accord by May 2025, one of the fundamental instruments for WHO and the member state to operationalize equity and reduce dependence. Thank you very much.
Thank you, Mozambique. I now give the floor to Eswatini to be followed by Finland.
Thank you, Mr. President. It is a privilege for the Kingdom of Eswatini to address the 156th session of the WHO Executive Board. Eswatini aligns itself with the statement delivered by the distinguished delegate of the Republic of Cameroon on behalf of the 47 members of the African region. We extend our appreciation to the Director General and the Secretariat for their continued leadership in advancing global health. As a small developing nation, with a strong commitment to universal health coverage, Eswatini has made significant strides in strengthening our health system, particularly in combating HIV/AIDS, tuberculosis, and non-communicable diseases. However, we remain aware of the challenges posed by emerging health threats, climate change, and the need for sustainable health financing. In alignment with WHO's priorities, Eswatini reaffirms its dedication to 1, strengthening primary health care as the foundation for resilient health systems, ensuring services reach the most vulnerable. 2, enhancing pandemic preparedness and response through regional collaboration and investment in health security. Addressing the double burden of disease and integrating non-communicable disease prevention with infectious disease control. As we engage, Mr. President, in these critical discussions, let us ensure that our decisions translate into tangible improvements for all our people. Global health equity must remain at the center of our collective efforts, and we look forward to constructive deliberations and reaffirm Eswatini's commitment to working with WHO and all our partners to achieve health for all. I thank you.
Thank you, Eswatini. I now give the floor to Finland to be followed by Uruguay.
Thank you, Chair. DG. Finland aligns itself with the statement of the European Union. We join others in appreciating the commitment of Dr. Tedros and WHO staff. As a global health community, we are faced with multiple challenges in safeguarding the health and safety of people around the globe. The potential to reach the Sustainable Development Goals in health by 2030 seems to be slipping away. We expect WHO to guide us, to provide accurate and up-to-date information, and to assist us in response to health threats. WHO and multilateral cooperation are also key to ensuring sustainable and timely access to the benefits provided by innovation and new technologies to address health challenges. The economic situation in many member states limits their ability to increase their contributions to global health institutions. The withdrawal of WHO's biggest financial contributor is leaving a gaping hole in the finances. WHO is also losing many of its critical experts. WHO's cost structure and activities must be adjusted. We need to pull together as a community to ensure that the crucial work of WHO can continue while taking a pragmatic approach on prioritization at all levels of the organization. Finland remains a strong supporter of multilateralism and WHO role as the leading global health agency. Thank you.
Thank you, Finland. I now give the floor to Uruguay to be followed by Japan.
Thank you very much, Chairman. Distinguished ladies and gentlemen, it's an honor for Uruguay to be able to participate in this meeting of the WHO Executive Board. I should like to begin by putting on record our gratitude for the efforts which have been made in order to tackle priority issues which affect global health and which we have been briefed about by the Director General. We'd also like to highlight one or two of the measures that our country has taken in step with the overall policy of this organization. Uruguay would like to reiterate her commitment to universal health coverage through initiatives such as our law which strengthens prevention and treatment of non-communicable diseases, guaranteeing equitable access to essential drugs and medicines. We are also putting health information on foodstuffs, and we have a policy to promote healthy lifestyles which will help to further combat this kind of illness. We are promoting mental health too, including suicide prevention and the strengthening of primary health care. We participate actively in the Mercosur strategy on health and climate change, and we have national plans helping us to mitigate the effects of climate change on health. As far as traditional medicine is concerned, Uruguay regulates practices such as homeopathic treatment and acupuncture in accordance with the 2023-2023 program. We've also been boosting our response capacity to deal with health emergencies and natural disasters by appointing national focal points for our emergency medical teams. And we've also been furthering cooperation between our institutions and our overall national emergency ministry. Last but not least, we would like to reiterate our commitment to the goals and principles of this organization and to working together with other countries and the organization to build a healthier and fairer future for us all. Thank you.
I just want to remind member states that try to limit your contributions to 2 minutes. I now give the floor to Japan to be followed by Bangladesh.
Thank you, Mr. Chair, Dr. Tedros, and colleagues. Japan would like to express gratitude for this opportunity. The first, I extend our appreciation to Director General and the WHO Secretariat for their unwavering commitment and efforts in addressing global health challenges.
Uruguay, could you switch your microphone off, please? Thank you. Excuse the interruption.
Thank you. As a member of the international community, Japan remains steadfast in dedication to working closely with the WHO and member states. We will continue to contribute to the achievement of UHC, the pandemic PPL, as well as tackling the complex global challenges, including those posed by climate change and population aging. Japan believes that WHO, as the leading agency of the United Nations in the field of health, must fully leverage its experience and take the lead based on scientific evidence on addressing global health challenges. In this context, Japan would like to emphasize 3 key functions that WHO should prioritize moving forward. The first is infectious disease crisis management, the global response to COVID-19 pandemic, as well as the ongoing efforts to tackle mpox, have underscored the critical importance of infectious disease PPL. The second is WHO's agenda-setting role. This year, the UNGN high-level meetings will be convened. Alongside UHC, WHO is expected to tackle the lead in shaping these crucial agendas in providing clear visions in convening the global efforts to tackle global health issues. The third is global WHO's norm-setting functions. This includes the international health regulation as well as the development of the better system national health accounts. We would like to once again emphasize the role of the setting these norms and standards is a fundamental responsibility that only WHO can fulfill. Thank you, Mr. Chair.
Thank you, Japan. I now give the floor to Bangladesh to be followed by El Salvador.
Thank you, Chair. We thank the Director General for the report and WHO team for their services, even risking their lives in war zones and conflict-stricken areas of the world. Health issues are uncompromising. Health issues are uncompromising when it comes to an individual person. Similar spirit is essential at national level. When countries are resource constrained at national level, international support is exigent. That is why international organizations came into being. Naturally, if the countries and people in need of external support don't receive support anymore, it will cost their reliance and trust on traditional international partners. Based on COVID-19 pandemic experience, we all came together for mobilizing resources for equitable access to health services, particularly access to vaccines, therapeutics, diagnostics, etc. at an affordable cost. Hence, we strongly advocate for diversification of production facilities across the continents to make them available to the people. We are deeply concerned at the attacks on hospitals and health services in conflict-stricken areas of the world. Bangladesh urges for necessary support to the people of Gaza and Palestine so that the dilapidated health facilities become functional as soon as possible. Despite financial constraints, any punctuation to the vital ongoing WHO program in vulnerable societies is unfortunate. It is the responsibility of the entire membership to strive for saving this program. We caution against fitting WHO staffs within financial envelope. We apprehend that in future, experts might not choose to be in IOS like WHO because of uncertainty in career. Finally, we hope that we all can join our hands to augment low-cost solutions as per the first WHO Global Status Report to minimize preventable deaths from drowning. I thank you, Chair.
Thank you, Bangladesh, sorry. I now give the floor to El Salvador to be followed by Botswana.
Thank you, Chairman. It's a pleasure to greet you, Dr. Tedros. We recognize and acknowledge the report you made, and we're happy to know that the pillars illustrated in your report are in line with the general approach that the Ministry of Health of El Salvador is taking, helping to paint a lighter picture than the dark one left to us by the pandemic. We've been doing a lot of work on NCDs, for example, with the support of WHO and PAHO, and that has helped us to gain recognition by the World Hypertension League. We've also been looking very closely at illnesses related to climate change, which are coming to add to the current public health burden. We also are eager to continue making headway on digital training and on using AI as a tool which will help us to improve our health services. Lastly, we acknowledge the budgetary challenges that all of us are facing, and we hope that your expertise will help us to achieve the best, most efficiently achieved and fairest possible results for your work. Thank you.
Thank you, El Salvador. We now give the floor to Botswana to be followed by Germany.
Thank you, Chair. Botswana aligns with the statement delivered by Cameroon on behalf of the WHO Africa member states. We thank the Director General for the comprehensive report and the notable progress that has been achieved during the previous year. In this regard, we note with appreciation the central role of WHO in global health governance. Botswana has made important strides in improving the health status of its population. This is through improved health financing for financial risk protection, decentralized governance structure to ensure delivery of essential health services, and human resource development. We are pleased of the collaboration between the WHO and Botswana with respect to the Botswana National HIV Reference Lab and the WHO Collaborating Center for Nursing and midwifery development. Chair, the attainment of universal health coverage everywhere and for everyone has always been and remains the underlying principle that should underline our work. However, Botswana, like many low and middle-income countries, face a disproportionate high burden of non-communicable diseases, including cancer, diabetes, cardiovascular disease, and other NCDs, which are the leading causes of mortality and morbidity. As we prepare for the UN high-level meeting on NCDs this year, we call on the WHO to prioritize supporting member states in order to meet our NCD targets for 2025. Member states have been working hard to negotiate a pandemic agreement. We thank the Bureau and the Secretariat for the dedication to this important work. We remain optimistic that the INB will build on the consensus reached so far and complete the outstanding work for consideration at this year's World Health Assembly. In closing, Botswana remains committed to work with the WHO, other member states and partners in order to deliver on the 6 strategic objectives of the GPW14. I thank you.
Thank you, Botswana. I now give the floor to Germany, to be followed by Ireland.
Dear Chair, dear Director General, dear colleagues, Germany aligns itself with a statement delivered by Poland on behalf of the European Union and its 27 member states. In these times of crises, we emphasize our unwavering commitment to WHO as the cornerstone of global health governance and an indispensable pillar of multilateralism. As an advocate of multilateralism, we will continue to support the WHO financially, politically, and technically. We call on all member states to join us in providing robust and sustainable financial support so that WHO is able to truly fulfill its mandate. Adequate funding is essential for the organization to maintain its independence and to respond to health emergencies effectively. Financing WHO means investing in a healthier future for global health, but also for each of our national health systems. We have a shared responsibility here. No single country can address global health challenges alone, and no single country can sustain WHO alone. We're concerned about the current challenging financial outlook and must prioritize. But simultaneously, we also see increasing demands from member states. Now more than ever, it is important to prioritize continuity of the essential programs, and it is also important to assess the cost implications of new suggested actions. This must also apply to resolutions. A comprehensive understanding of the real impact and costs of proposed new resolutions, such as detailed estimates of implementation costs and resource requirements for staffing, are fundamental. And we would suggest fewer resolutions and clear costing estimates from the beginning. Now, finally, let us stand together in our mission to achieve health for all. Thank you very much.
Thank you, Germany. I now give the floor to Ireland, to be followed by Chad.
Thank you, Chair. Honourable Chair, distinguished Director General, distinguished delegates. Ireland aligns itself with the statement delivered by Poland on behalf of the European Union and its member states. We thank the Director General and his team for the comprehensive report which reflects the breadth of work undertaken by the WHO. There is no doubt that we are facing challenging times for the WHO and for the multilateral community as a whole. In our view, the WHO plays an essential role in the cooperative global health architecture, and the profound and positive impact on all our health and well-being since its formation in 1948 cannot be overstated. We've taken note of President Trump's decision to withdraw the United States from the WHO. We remain firmly a strong supporter of the WHO. Global health challenges require us to work together. We are affected by geopolitical conflicts and infectious disease outbreaks that threaten human security, as well as climate-related disasters, increasing non-communicable diseases and demographic shifts. The impacts of such challenges do not respect our national boundaries and fall heavily upon our young and old, rich and poor, to our collective detriment. It is vital, therefore, that we face these challenges in solidarity with consistency and for our shared benefit. We must come together to strengthen our ties, to remain conscious of our interdependence, and to strive for the collective health of our national, regional, and global communities. WHO's growing responsibilities makes financial sustainability crucial, and as such, predictable funding is vital for WHO to plan effectively and to fulfil its mandate. The cost implications of any new action should therefore be assessed to ensure the continuity of existing and essential programmes. In conclusion, Ireland is committed to strengthening our collaboration with WHO and fellow member states. We will continue to improve our ability to access invaluable technical support, implement best practice and global efforts across public health spectrum to build a healthier future for all. Thank you.
Thank you, Ireland. I now give the floor to Chad, to be followed by the Russian Federation.
Thank you very much, Chairman. Chairman, WHO Director General, ladies and gentlemen, members of the Executive Board. To begin with, thank you to the Director General and Will Setzer for your report, your very detailed report, which you provided to us. You've given us such reports over many years. We're very grateful for them and for the work done by your organization over all that time. We would like to align ourselves with the statement made by Cameroon on behalf of the African Group. As far as our country, Chad, is concerned, yes, health is a priority for us, but we are facing a lot of problems and challenges. As you know, we're trying to strengthen our health system. We're having to tackle neglected tropical diseases. We have a rise in non-communicable diseases, and we need to improve our primary healthcare system too. We're very grateful to WHO for having set up the WIPO Academy in Lyon, because we're pretty sure that that will be of great help for us in developing the skills of our colleagues in the field and on the ground. As you know, Chad is a peaceful country surrounded, unfortunately, by countries in conflict in the north, in Libya, in the west, the Lake Chad with Boko Haram in the center, Central African Republic, and to the north, Sudan. So one major problem we have is a mass flow of refugees into our country, of Sudanese in particular, and this causes major problems for the locals too. If you look at the city of Hatre, which is a border country, the possibility that is a city which has 100,000 inhabitants normally. It now also has to cope with 250,000 refugees. It goes without saying that that creates this problem for everyone, and we have internally displaced people too. WHO gives our Ministry of Health much needed support, and we urge others to offer our country support in its attempts to meet all these challenges. WHO's work has a great positive impact on the health of African peoples, bringing down death among young people and mothers and children in particular. Thank you.
Thank you, Chad. I now give the floor to the Russian Federation, to be followed by Namibia.
Thank you very much, Chairman. Chairman, Director General, distinguished colleagues, we are grateful to the Director General for the report which he has submitted to us and for the work of the organization carried out over the last few years. We are convinced that the international community is interested in WHO's retaining its leading role as the main organization responsible for tackling substantive problems relating to global health. For this reason, the selection of the organization's priorities and making that process effective is extraordinarily important. At the 77th WHA, we have had a new GWP adopted, setting the priorities of the organization, and we are happy to continue to provide expert assistance and support to the organization and to countries, particularly in fighting infectious and non-communicable diseases. At the same time, and in respect of the agenda of the organization, we have noted some irrelevant issues and some politicized issues which have led to ignoring more important issues. There are several items of the agenda under the heading Climate Change, for example, including certain thematic questions, and that makes it difficult to actually hold discussions having everything all mixed up. Some countries have mentioned the negative effect on health of certain restrictive or coercive measures which have been taken by individual countries. This affects not only ordinary people who cannot get access to the medical assistance they need, but furthermore, it makes it impossible to provide sustainable financing to the organization, that in its turn undermines the organization's ability to react quickly to health emergencies. We need to remember that the decisions of this organization need to be based on consensus, taking into account the positions of all countries. And this is a position which should underlie all decisions, include those taken in the INB on an international pandemic treaty. Thank you.
Thank you, Russian Federation. I now give the floor to Somalia.
Chair, Director General, and esteemed delegates, Somalia warmly welcomes the Director General and thanks him for his comprehensive report. We deeply appreciate the ongoing work of the WHO, which continue to be an invaluable partner in strengthening global health systems and enhancing the capacities of individual countries. The guidance provided by WHO in critical areas such as health system strengthening, emergency preparedness and response has been essential. We recognize and commend the significant technical contributions made by WHO, which have supported countries in addressing complex health challenges. We also extend our gratitude to WHO for its timely response on multiple emergencies and outbreaks around the world. These efforts have been instrumental in saving lives and protecting communities. We emphasize the importance of prioritizing universal health coverage to guarantee health for all. Thank you.
Thank you, Somalia. I now give the floor to Namibia.
Many thanks, Chair, for the floor. Namibia aligns with the statement delivered by Cameroon on behalf of the African region. We thank the DG for his report and commend the WHO's continued commitment to addressing global health challenges. Namibia strongly aligns with the goals of promoting, providing, and protecting health under the UHC umbrella. The DG's report highlights the importance of strengthening primary healthcare systems, a focus that resonates deeply with our national priorities. We take note of the theme for the 2025 World Health Day, which is timely considering that the deadline to meet the SDGs is around the corner. We welcome the proposed program budget 2026 to 2027 and appreciate the efforts to ensure transparency, efficiency, and accountability in its formulation. The 20% increase in assessed contributions, which we support, reflects the collective commitment by member states to support health system strengthening in countries. We urge for budget considerations that address country-specific health priorities and challenges enabling impactful outcomes tailored to regional needs. Namibia underscores the importance of predictable, flexible, and sustainable financing for WHO, which is the only member state-led organization mandated to promote health, keep the world safe from public health emergencies, and serve the vulnerable by addressing global health issues. We thank donors for their contributions towards the investment round and express support to the Secretariat's resource mobilization efforts. In closing, a strong and well-supported health workforce is a cornerstone of effective healthcare delivery. Investments in training, retention, and equitable distribution of health professionals remain crucial to a strong and resilient health system. Thank you.
Thank you, Namibia, and I'll give the floor to Belgium.
Thank you, Mr. Chair. Mr. Director General, Belgium aligns itself with the statement delivered by Poland on behalf of the EU and its member states. Belgium would like to begin by thanking the DG and the entire WHO staff for their invaluable work. In these times of geopolitical tensions and increasing misinformation, our support for WHO remains steadfast and indispensable. We also welcome the ceasefire in Gaza and strongly condemn all attacks on healthcare professionals and infrastructure. Belgium is deeply concerned about the humanitarian situation in Eastern Democratic Republic of the Congo. We are alarmed by the devastating impact on public health and call for the respect of international humanitarian law and human rights. We also deeply regret the withdrawal of the United States, a decision that weakens both multilateralism and global health. In these challenging times, it is more important than ever to focus on our core mission. Together, we must strive to foster meaningful multilateralism that delivers concrete results on the ground. We also stress the critical importance of WHO's efforts to combat misinformation, a major challenge undermining public health. Finally, we share the concern expressed by many others about the demanding agenda of the 23 resolutions, characterized by sensitive and lengthy discussions that consume valuable time and energy. We would welcome a more streamlined decision-making process with fewer resolutions to obtain a realistic set of priorities. I thank you for your attention.
Thank you, Belgium. Members of the board, colleagues, earlier this morning when I started, I said that we would break for lunch at 12:30. It is now 12:30, and I propose that we will suspend further consideration of this agenda item number 2 until after lunch, with the intention to resume at 2:30, exactly at 2:30. And thank you. We now break for lunch.
Thank you.
We are having a two teeth problems. We have some teeth problems.
you.